Thank you, Mr. Chairman. Thanks to each of you witnesses for providing us some thoughtful testimony. In Texas, we have a criminal law that says if you witness abuse or neglect of a child, you have a duty to report that. And failure to report that is actually a crime. What I'm trying to understand, Ms. Graves, is are you saying once the child is delivered, if there is neglect of a living child, that you don't have to report it and you can just, that child's life is somehow not covered by laws like this, which I'm sure are common in all 50 states?
What I'm saying is that framing isn't an accurate description of what's happening when we have a situation like the situation we're describing, when these last moments and sometimes hours, families are trying to comfort and deciding that that's how they're going to spend their time with their dying child.
So you're saying that the law, like I described to you, that requires a person to report child abuse or neglect should not apply in this context?
What I'm saying is, in those situations, doctors are already providing the standard of care. And the only question is...
The standard of care to who, the mother or the child?
To both. To both. I actually think that that's one of the things about the bill that does not make sense to me. It's not necessary because doctors already have to provide a standard of care.
So
and in those last moments...
In your view, it's consistent with the standard of care required for physicians to let the baby die or to terminate the baby's life.
What I'm saying is that these are babies that are already dying. And the question is, in those last moments, who is making the determination about how those last moments are going to be spent?
So you think all of these children born alive after a botched abortion are going to die anyway?
Again, I really reject the framework of the question. The framework
your job is to answer questions. It's my job
I
to
understand,
ask questions.
Senator, but
Well, let me go on to the doctor and see if I can get some straight answers. Doctor, in the instance where you have a pregnant woman who delivers a baby alive, no matter what the circumstances, do you have one patient or do you have two patients?
My personal patient is the baby. The OB is taking care of the mom.
All right. And do you recognize the duty of medical practitioners and actually of all citizens to report child abuse or neglect when you witness it?
Yes.
I'm just trying to figure out, in Roe versus Wade, 1973, the Supreme Court said that after viability, that the state has an interest in the life of this unborn child. And of course, there's been a lot of iterations of that standard since that time. But what I'm trying to understand, and Ms. Mosley, maybe you have some thoughts about this, is why, even in spite of the fact that the state has an interest in protecting the life of an unborn child post-viability, why somehow that would not apply once the child is actually delivered alive?
Absolutely. I think the logic that needs to be followed here is that it was a bipartisan effort to declare that an infant who survives abortion is a full person under the law. And the legal definition of alive means they have a breath, a heartbeat, a pulsating umbilical cord. There's muscle movement. So a child can be clearly defined as alive by a medical expert. And should they be given care as any other newborn patient? The answer is yes. If they are already logically defined as a person, then they should be entitled to the care given to any other person.
Well, I know a number of the members of the committee have said they find this topic difficult, and certainly that's true. But for me, I think part of what makes that difficult is when we fail to respond to something that our conscience tells us we need to respond to, and to not ignore the facts and decide this based on ideology or politics. And so I'm glad, Mr. Chairman, we have a committee where we can at least get the information, and we can use that to make good policy that protects all of our citizens. Thank you.